Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, MELDITA'S Info Corner. This is the continuation of our pulseless VT or cardiac arrest last week. But this time, our second video will be about CPR in adult in a CCU setting. So CPR means cardiopulmonary resuscitation. The patient is not breathing. The patient has no pulse. So we're going to be applying ventilation and chest compression. But in CCU, once we identify that the patient is in cardiac arrest or pulseless ventricular tachycardia, we don't normally do the ventilation, but we go right away and do chest compression because one nurse is already grabbing the defibrillator, and in a minute or less than 2 minutes, we're able to terminate ventricular tachycardia, pulseless. Okay, so chest compressions. First, we talk about the landmarks here. So we have here the sternum or the so-called breastbone. So the sternum, the head part is called the manubrium. There is the body and there's the xiphoid process. So to put your hand in the right place, we have to put 2 fingers here horizontally here. And then from there, you put your hand, which is already the lower half of the sternum or the center of the chest. Okay. So what part of your hands to be applied to the patient's chest? Okay, the heel of your first hand will be sitting on the lower half of the sternum. And the second heel, or the heel of the second hand, will be sitting on top of the first hand. All the fingers are interlocked and all the fingers are not touching the patient's skin. Okay, chest compressions. Let's start with the chest compression. What are we going to think about here? So what will RNs do? First, hardboard. Hardboard is very important when doing CPR. Okay, and that will be applied at the back of the patient. Here's the hardboard. I colored it green. These are all my drawings. Okay, so that's the hardboard. So when you squeeze or compress the patient, it will be very effective because it's hard surface. Okay, the RN compressor number 2 is at the patient's side. So this is the RN compressor at the patient's side here. Okay, next, number 3, the heel of the first hand, as I mentioned earlier, should be sitting on the lower half of the sternum. Okay, and the heel of the second hand will be on top of the first hand. All the fingers are interlocked and all the fingers are not touching the patient's skin. Okay, 4, you got to straighten the arms. Okay, with the shoulders over the hands. This is the compressor. Okay, compression. Compressions here. Now we're going to squeeze the heart. This is the compression here. Okay, you have to press down the chest to 2 inches down or 5 centimeters. Okay, and the rate will be 100 to 120 compressions per minute. So the count will be very fast. So it's just like 1, 2, 3, 4, 5, 6, 7, 8, and so on. So if we take a rate of 120 compressions per minute, it's like you're applying 2 compressions per second because in 1 minute you have 60 seconds. Okay, but usually the range of the rate of the compressions is 100 to 120 compressions per minute. Okay, after compressions follows relaxation. This is your recoil, or your refill, or re-expansion. So do not take off your heel of your first hand on the patient's landmark, which is the lower half of the sternum or of the skin. Leave it. But those hands are not doing any compression. They're relaxed, okay? So blood will flow into your heart, okay? Will refill again. That is the one that we use to squeeze to support the organs of the body, okay? So when you squeeze, the heart is squeezed, it becomes smaller. The blood is ejected and goes to the major organs, okay, to all parts of the body. Because your hands serve as the force or the pump here. It is your hands. Your heart is not working. It's you that is working for this heart. So your hand serves as the pump, okay? And in here, in the relaxation here, you got the recoil. Okay, so that looks bigger and blood is going again back to your heart. So you have to have a good refill or recoil to be able to have a good blood squeeze out during compressions. Okay. So number 7, you got to minimize interruptions here. Never disturb your compressors. If it's really very emergency, then it should be 10 seconds or less. But I suggest no. Okay, as much as possible, no. Okay, then switching with the compressors. It should be every 2 minutes, or when the compressor complains of feeling weak or fatigued, then we have to relieve the compressor. Okay, so as I said in the CCU setting, we don't normally do ventilation because we have a defibrillator available in the unit, and we can terminate the pulseless VTAC in less than a minute, or maybe a little bit less, more than a little bit of a minute, but less than 2 minutes here. Okay, so let us assume that our first defibrillation did not work or did not affect the patient. So we have to continue CPR. And if our CCU has our own team, the RT arrives, the doctor arrives, because the CCU RNs are the one responding, they are the first responders to this pulseless VTAC or cardiac arrest. Okay, so if the RT arrives, the RT will connect the face mask to the ambu bag and start bagging or ventilating the patient. CPR continues. Okay, so there we go. So that is a bag mask ventilation with a compressor to rescue our CPR. So in here, they normally, if the ventilation rates in here, let's say the patient is in cardiac arrest, so the ventilation will be once every 6 seconds. If the patient is in respiratory arrest, then the ventilation should be once every 5 to 6 seconds. How about the speed of the ventilation? It should be over 1 second. And how about the volume of the ventilating bag or the ambu bag? It should be about half of a bag, but avoid excessive ventilation. Okay, so sometimes if our third attempt of defibrillation failed, then the patient has a refractory ventricular tachycardia here. We resort to medications. We continue our CPR. We continue debagging, but this time the RT will be intubating the patient. So there will be a bag to endotracheal tube ventilation. So the black one, that is our endotracheal tube. Okay? So that's about it. It's very important that in CCU, as I said, our first response when somebody goes into cardiac arrest actually is very crucial, is very important, is chest compressions. We have the defibrillator in the unit. It takes less than probably a minute. We are already there, connect the patient, and we were able to convert the patient. Maybe a little bit like more than a minute, but again, not ventilation. Our priority is chest compressions. But if the ventricular tachycardia pulseless is refractory, then that will end up having the team arrives if you don't have cold blue team in the CCU. And the RT will be again doing the bag mask ventilation, but CPR continues, or maybe to endotracheal tube ventilation. Okay, so remember those things. Hardboard is number 1. Be sure that you have that before you start your chest compressions. Okay, you know your depth, you know your rate. Okay, and be sure that everything is done quickly, and we will be able to succeed. Okay, so that's about it. And if you think this is helpful, you are